mammals. We can now talk about external respiration. Which involves as I told you, inhalation and exhalation. Now, inhalation is breathing in of air rich in oxygen, and exhalation is breathing out of air rich in carbon dioxide. Now, how is this one done? That takes us to what we call mechanism of look at this diagram. Now, we're talking about external respiration. It has to involve this system. We are seeing the diagram of a respiratory system, starting from the larynx, the trachea, this is voice box, this is the trachea, we call it windpipe as well, branching out to smaller branches called bronchi, or one of them bronchus. The bronchi branch out to what we call bronchiole. Now, and the bronchiole end up in air sac, or what we call alveoli. Alveolus, one, alveoli, plural. So we have alveoli in the lungs, or we call them air sacs. This is the structure, and this place is what we call the thoracic cavity, the rib cage where you have the lungs. Now, the rib cage is separated from the abdomen by this sheet of muscle that we call diaphragm. Now, the ribs themselves, we know, are of bones connected to the chest bone, the sternum, and the backbone. But here they are cut to show their position. Between the ribs, we have muscles that surround the ribs. We call them intercostal muscles. Now, for one to be able to inhale, low pressure has to be created in the lungs. And how could this be done? The intercostal muscle around the ribs and the diaphragm itself have to contract. And when they contract, the diaphragm will now become lowered and flattened. Because of the contraction of the intercostal muscles, the ribs will move outward and upward. This action causes larger thoracic volume. That is thoracic cavity volume. The volume will be increased. And once that one is increased, the pleural membrane will also expand, leaving more spaces for the lungs expand. And because of the increase in size, there will be low pressure created inside the lungs, and air has to flow through the nose into the pharynx. From the pharynx, it enters the trachea, the larynx, and from the larynx, the trachea, bronchi, and bronchioles, and eventually end up in the air sac.